Hello, in this video I'm going to take you through antihypertensive agents. So antihypertensive agents, these are drugs that are used to lower elevated blood pressure in a number of ways. Three classes of drugs are used for first-line treatment of hypertension: thiazide diuretics, beta adrenoceptor antagonists, which are also known as the beta blockers, and the angiotensin converting enzyme inhibitors. Calcium channel blockers are considered first line in specific populations only, for example Africans or the elderly. Other classes of drugs may be used in certain situations. So antihypertensive agents help to lower the total peripheral resistance, lower cardiac output, reduce blood volume and body sodium stores, as well as act centrally in the central nervous system. Let's look at thiazide diuretics. Thiazide diuretics such as hydrochlorothiazides have been used as first-line antihypertensive therapy and are particularly indicated in the elderly. There are few side effects in low doses, but in large doses they may cause a variety of unwanted metabolic effects, principally the potassium depletion. There is also reduced glucose tolerance, ventricular ectopic beats, and impotence. They should also not be used in gout. These effects can be reduced by keeping the dose as low as possible. Higher doses do not produce an increased reduction in blood pressure. Thiazides are inexpensive and when used in combination can enhance the effectiveness of many other classes of antihypertensive drugs. Now, before we go any further, what you need to know about diuretics as a whole, not just thiazide diuretics but just diuretics, is that these agents, they act by promoting renal excretion of salt and water by blocking tubular reabsorption of sodium and chloride. The resulting loss of fluid reduces ventricular filling pressure, which is the preload, and produces consistent hemodynamic and sympathetic benefits in the patient with congestive cardiac failure, and rapidly relieves dyspnea and peripheral edema. These diuretics, they decrease blood pressure by depleting body sodium stores, thereby reducing blood volume. They are used in monotherapy in mild to moderate blood pressure. Diuretics are used in fluid retention resulting from cardiac, renal, or hepatic failure. They cause electrolyte loss, especially potassium and sodium, in addition to water. They should not be used in conditions like kwashiorkor. Different types of diuretics are available. The potency varies according to the site of action. They are combined with the vasodilators in severe blood pressure. So now let's look at the nursing implication, the general nursing implication for these diuretics. Okay, so diuretics can increase serum glucose and the cholesterol levels. Therefore, you need to monitor for hyperglycemia as well as the hypercholesterolemia. Then you need to teach patients to take diuretics in the morning to avoid nocturnal diuresis and the urination. Caution patients to stand up slowly to minimize the risk of dizziness from orthostatic hypotension. You also need to monitor for signs of hypokalemia such as muscle weakness and changes in mental status, including confusion and irritability. Patients taking a potassium-sparing diuretic are at risk of hyperkalemia. Therefore, the risk is especially high in patients also taking an angiotensin enzyme inhibitors. So therefore, you need to keep on monitoring the patient for hyperkalemia. So you need to monitor the electrolytes levels. Another nursing implication is that you need to weigh patients daily at the same time using the same scale. Report a significant weight gain. Okay, you need to report a significant weight gain. So a weight gain of 1 kg or 3 pounds in 3 days should be reported immediately. Okay. Then another nursing implication is you need to remind your patient that even if he or she feels fine, he should keep appointments with the healthcare providers because renal function must be monitored. Okay, so let's look at examples of diuretics, other examples of diuretics. So another type of diuretics that we can look at is loop diuretics. Now before we look at the loop diuretics, there is something that I forgot to mention under the thiazides. Okay, so the thiazides, they are the most frequently used class of diuretics because they are effective at a low dose and they are mostly used in combination with a potassium-sparing diuretic. And I gave you an example of thiazide diuretic, which is hydrochlorothiazide. So this hydrochlorothiazide, it comes as a tablet containing 25 milligrams and it is indicated in edema and hypertension. The dose for hydrochlorothiazide is 25 milligrams and it can be increased to 100 milligrams daily if necessary. The side effects are hypokalemia, muscle weakness, cardiac arrhythmias, and it is contraindicated in hypercalcemia as well as in renal failure. It is also contraindicated with other drugs in more severe hypertension. Alright, now let's look at the loop diuretics. So an example of a loop diuretic is furosemide, which is also known as Lasix. It comes as a tablet containing 20 mg and as an injection containing 20 mg. The action of this drug is that it acts by reducing sodium and chloride reabsorption in the ascending limb of the loop of Henle. So these agents, they produce marked potassium loss and promote an increase of uric acid in the blood. It is indicated in edema, which is due to heart failure. It is also indicated in oliguria, which is due to renal failure. So the dose of the Lasix is 20 to 80 milligrams daily, which is given through the mouth, also through IM, as well as when you give that, it should be given with potassium 600 milligrams daily. Now this potassium should be through IV, so we refer to it as slow IV. So it is given slowly through the intravenous. Okay, so the dose once more is 20 to 80 milligrams, which can be given through the mouth or IM, together with the slow IV with the slow K, which is the potassium 600 milligrams daily. So it is contraindicated in oliguria, which is due to hypokalemia, and also it is contraindicated in fluid depletion. So the side effects are dehydration and hypokalemia. Okay, let's look at another type of diuretics, which are the potassium-sparing diuretics. An example of such is the spironolactone. So this is a specific competitive antagonist to aldosterone, producing a weak diuresis with a potassium-sparing action act at the distal tubules, preventing the potassium excretion in exchange of sodium. So these are weak diuretics, but are useful in combination with more powerful loop diuretics. However, they should be avoided in patients with renal failure and those taking the ACE inhibitors. So spironolactone, it comes as a tablet containing 50 milligrams to 100 milligrams. The action is that it is an aldosterone antagonist potassium-sparing diuretic. The dose is 100 to 200 milligrams daily. So the side effects is impotence, gynecomastia, menstrual irregularities, lethargy, and hyperkalemia. So the interaction of this drug is that it has an interaction with the ACE inhibitors and antagonists, which leads to hyperkalemia. So this drug is contraindicated in hyperkalemia, hyponatremia, and the Addison's disease. Another example of a potassium-sparing diuretic is amiloride with hydrochlorothiazide. So amiloride with hydrochlorothiazide. So this is also known as diuretic. So the presentation for this drug is it comes as a tablet of 5 milligrams of amiloride and 50 milligrams of hydrochlorothiazide. So the indication is edema and mild hypertension. The dose is 2 to 4 tablets daily in 2 divided doses. So this drug is contraindicated in diabetes mellitus and in hyperkalemia. So the side effects includes dry mouth and hypotension. Okay, so before we move on to look at another type of antihypertensive agent, just on the diuretics, there is also another type, which is also the osmotic diuretic. Okay, these osmotic diuretics, they an example that I can give you is mannitol. Okay, that is mannitol, mannitol. So the presentation of this drug is that it comes as an intravenous infusion containing 10%, 20% solution of 500 mils. So the indication is it is indicated in fluid retention, in cerebral edema, and also and induction of forced diuresis. So the dose is 50 to 200 grams over 24 hours, which is preceded by a test of 200 milligrams per kg body weight by slow intravenous injection. So the side effects are chills, fever, fluid depletion, and hypotension. So this drug should be given with caution if you are giving it as an so it should be given with caution when you are giving it through IV solution, and that IV solution should be kept at room temperature. Then it is contraindicated in dehydration as well as in congestive heart failure. Alright, So now let's look at the beta blockers, also known as the beta adrenoceptor antagonists. So the beta adrenoceptor antagonists, also known as the beta blockers, examples of such drugs are atenolol. So these drugs are effective in all grades of hypertension and are particularly useful in angina and following myocardial infarction. They should be avoided in asthma, in chronic obstructive pulmonary diseases, and in heart block. So the next implications for the beta blockers is you need to assess for manifestation of heart failure, you need to check the pulse rate regularly, and also you should not withdraw the drug suddenly in patients with heart diseases. So atenolol tablet, the dose is 50 to 100 milligrams once daily or twice daily. Then the side effects are bradycardia, fatigue, insomnia, as well as sexual dysfunction. Another example of the beta blockers is propranolol. This one, the dose is 40 milligrams once daily. Then the side effects are bronchospasm, bradycardia, nightmares, insomnia, postural hypotension. Okay, let's look at the angiotensin II receptor antagonists, also known as the ARBs. So these are a new group of antihypertensives. This group is similar to the SCE inhibitors in that they prevent the release of aldosterone. They act on the renin-angiotensin system. The difference between the SCE inhibitors and these drugs is that the ARBs block the angiotensin II from the AT1 receptors found on many tissues, whereas the SCE inhibitors inhibit the angiotensin converting enzyme in the formation of angiotensin II. So the ARBs cause vasodilatation and decrease peripheral resistance. So the general side effects for these drugs is there is symptomatic hypotension, there is dizziness, there is hyperkalemia, and there is the angioedema. So the next implication is that you need to assess the patient for hyperkalemia, also assess the patient for angioedema, which can lead to airway swelling and requires emergency treatment. There is also a history of assess if there is a history of angioedema, which is contraindicated in the use of the ACE inhibitors. So an example of the ARBs is losartan, potassium, okay, also known as the COSA. So this drug is combined with hydrochlorothiazide. It is combined with hydrochlorothiazide. The dose is 25 to 50 milligrams daily in a single dose or 2 divided doses. Maximum dose is 100 milligrams daily. The side effects includes dizziness, insomnia, and of course a cough, which is occasional. So this drug, when it interacts with the potassium-sparing diuretics, it leads to hyperkalemia. So it is contraindicated in pregnancy, renal and hepatic impairment. Another group of antihypertensive agents is calcium channel blockers. So these agents, they effectively reduce the blood pressure by relaxing the muscles of the blood vessels. So some slow the heart rate, thereby reducing the force of the cardiac contraction. Drugs such as nifedipine are useful for isolated systolic hypertension. In populations unresponsive to other antihypertensives, agents, and in the elderly where the thiazides cannot be used. So short-acting formulations of nifedipine should be avoided as they may evoke reflex, tachycardia, and cause large variations in blood pressure. So the general nursing implications for calcium channel blockers is one, you need to tell the patients to report dizziness and symptoms of an irregular heart rate. Teach your patients to avoid grapefruit juice because it inhibits the hepatic metabolism of calcium channel blockers and may lead to increased blood drug levels and increased pharmacologic effects. All calcium channel blockers should be used cautiously in patients with heart failure. So an example of calcium channel blockers that I've mentioned is nifedipine. There is also amlodipine. So let's start with amlodipine. So amlodipine, the dose for this drug is 5 to 10 milligrams daily. Then the side effects is peripheral edema, headache, flushing, dizziness, nausea, marked hypotension. Then this drug, with interaction with digoxin, the drug increases digoxin levels. There is also bradycardia which occurs. Then there is cardiac heart failure. And then when it interacts with quinidine, it decreases the effects of amlodipine. So amlodipine, if it interacts with digoxin, there's going to be the digoxin levels are going to be high. Then there's going to be bradycardia. Then there could be cardiac heart failure. Then when it interacts with quinidine, there is a decrease in the effect of amlodipine. So this drug is contraindicated in hypertension. Then nifedipine is another example of the calcium channel blockers. So nifedipine, it comes as a capsule containing 5 milligrams and 10 milligrams. It also comes as a tablet. So this drug, the dosage is 10 milligrams sublingual or orally. Then the side effects, so it is given once daily. Then the side effects is dizziness, fatigue, nausea, headache, and edema. Then the contraindication is that it is contraindicated in hypotension. Okay, so it is also contraindicated in pregnancy. So another group of antihypertensives, we have the vasodilators, which are specifically the peripheral vasodilators. So these drugs act on the central nervous system, and they are also effective antihypertensive drugs. Okay, so in particular, methyldopa is effective in the treatment of hypertension in pregnancy. These drugs, they act by relaxing the smooth muscle of blood vessels, mainly the arteries, causing vasodilatation. These generally promote an increase in blood flow to the brain and kidneys. With vasodilatation, the blood pressure decreases and sodium and calcium are retained, resulting in peripheral edema. So diuretics can be given with direct acting vasodilators to decrease edema. So side effects of the peripheral vasodilators includes tachycardia, palpitations, edema, nasal congestion, headache, dizziness, GIT bleeding, tingling, and numbness. There is also excessive hair growth. The nursing implication is that you need to assess the BP every 1 to 4 hours. You need to monitor electrolytes and other blood studies before starting the medication, and you also need to monitor the weight gain as the drugs can cause edema. So examples of peripheral vasodilators, we have hydralazine. Okay, hydralazine comes as a tablet as well as an injection. So as a tablet, the presentation is 25 milligrams and 50 milligrams. Then as an injection, it is 20 milligrams. So the indications for hydralazine is it is given in treatment of moderate to severe hypertension. Okay. Then it is also indicated in hypertension crisis, where it is given through intravenous injection. So the dose, through the mouth, you give 25 milligrams twice daily, which is increased to a maximum of 50 milligrams twice daily. By slow intravenous injection, you give 5 to 10 milligrams over 20 minutes, which may be repeated after 20 to 30 minutes. So now this hydralazine, when it is being given, it is diluted with 10 mL of sodium chloride, which is 0.9%. So it is diluted with normal saline. Okay. Alright. So the side effects of hydralazine is tachycardia, nausea, vomiting, fluid retention, headache, systemic lupus erythematosus, and then this drug is contraindicated to patients who are hypersensitive to hydralazine, to patients who have rheumatic heart disease, specifically the mitral valvular rheumatic heart disease. Another example of the peripheral vasodilator is the diazoxide. Diazoxide comes as a tablet containing 50 milligrams. It is indicated in chronic intractable hypoglycemia as well as in hypertension. So this drug is chemically similar to thiazide diuretics but has no diuretic effect. However, it is a potent dilator of arteries. It exerts direct vasodilator effect by opening arterial potassium channels, and this has the effect of stabilizing the muscle cell membrane at resting levels. The drug is a plasma protein bound, which extends its half-life in circulation. So the indication specifically is hypertensive emergence. So the side effects that it has is hypotension, reflex tachycardia, it increases in cardiac output, angina, and also insulin inhibition. Then the dose for this drug, it is given as 5 milligrams per kg body weight daily in 2 to 3 divided doses. So this drug is contraindicated in ischemic heart diseases and in hyperglycemia. So let's look at the centrally acting antihypertensives. So these are drugs which decreases the sympathetic response from the brainstem to the peripheral vessels. They stimulate the alpha-2 receptors, which in turn decreases the sympathetic activity and then increases the vagus activity, and ends up reducing the cardiac output as well as the serum epinephrine, norepinephrine, and the renin release. All these actions result in reduced peripheral vascular resistance. So an example of the centrally acting antihypertensive is methyl dopa. So methyl dopa comes as an injectable and as a tablet. As an injectable, it comes as 50 milligrams per ml, and as a tablet, it comes as 250 milligrams and 500 milligrams. So the dose is 250 milligrams 2 to 3 times daily initially, and increased at intervals of 2 or more days, maximum of 3 grams. In elderly patients, 125 milligrams twice daily is given, then increased gradually to a maximum of 2 grams daily. So the side effects includes dry mouth, stomatitis, bradycardia, postural hypotension, headache, psychosis, and it is contraindicated in depression. It is contraindicated in active liver disease. Now, this drug, when it is taken with alcohol, it induces central nervous system depression, and it also increases the hypotension. And if it is taken with haloperidol, the drug, it increases the psychosis. So the next implication for methyl dopa is you need to monitor blood studies before commencing the drug. You need to monitor edema in the feet, legs daily. Okay, and you need to check the weight of the patient on a daily basis. You also need to monitor the central nervous system symptoms, especially in the elderly. So depression and also changes in the mental status. That marks the end of antihypertensive drugs. Okay, so we're going to look at some just few review questions, and I need you to be pausing the video when you are reading the question, and then once you are done, try to answer, and then at the end I'm going to give you the correct answer. So this is question 1. Pause the video, go through the question, then try to attempt. Okay, so the correct answer is calcium channel blockers. Okay, so for question 2, the correct answer is hyperkalemia. I hope you've attempted. And 3, so pause the video, go through the question and try to answer. So the correct answer for this one is potassium-sparing diuretics. Question 4, do the same thing, pause, read through, try to answer. So the correct answer is spironolactone. Question, pause, read through, then try to answer. So the correct answer for question 5 is blocking the release of aldosterone. Question 6, do the same thing, pause, go through, try to answer. So the correct answer is angiotensin converting enzyme inhibitors. So last question, pause, go through, try to attempt, and the correct answer is angiotensin II receptor antagonists. That's the correct answer. So that's all I had for you. If you have any other questions, comment, and then I'll get back to you.